what we're going to talk about today is called New Help for Depression. Now, everybody has experienced depression. Is there anybody here that hasn't? Okay, almost everybody on the planet has experienced depression, but in medicine many times there is always a definition of what depression is. And sometimes you'll be surprised at what is included as a component of depression. So let's look and see what basically medicine calls depression. So defining depression is the patient has depressed mood, such as sad or empty feeling, or loss of interest or pleasure, most of the time for 2 or more weeks, plus 4 or more of the following symptoms. That would be sleep disturbances like insomnia or hypersomnia nearly every day. So too much sleep or not enough sleep. Okay? Interest, markedly diminished interest or pleasure in nearly all activities most of the time. Guilt, which is excess or inappropriate feelings of guilt or worthlessness most of the time. There's a loss of energy or fatigue most of the time. There's diminished ability to think or concentrate, indecisiveness most of the time. Appetite increased or decreased, okay? And suicidal thoughts, thoughts of death, okay? Now, it's interesting that most people would never have put diet problems in the depression thing. Or if you're insomnia, like you're not able to sleep, many times they would never have put depression as there. Because most of the time we think of depression as very sluggish. You don't want to get out of bed. You're sleeping a lot. You're just sleeping your life away type thing. But you see there's a lot of other things that is considered depression. Now this definition I'm going to come back to, as you're going to see later, because we're going to kind of help you understand in this seminar some of the realities of medicine, natural medicine, and some of the realities of allopathic medicine in how we treat these illnesses and what options that you have on the natural side of things. But I want to introduce to you, to lead into this, how does medicine actually address depression? And this is a law of pharmacology. It's my own law. It may be a law somewhere, but I wanted to call this a law because most people don't understand that every drug's primary long-term effect is to cause the same symptoms as that which it initially was correcting. Now think about that. I mean, this is a new revision of something I've always said. And maybe if you've read my blogs, you would see, I would say every drug's primary side effect is its primary action. Okay? So if you take an insomnia drug, even if it was the perfect insomnia drug for you, there's a point to where it's done what it can do and you should get off of it because you go through the correction and out the other side and it starts creating the very same thing it was originally helping you with, which is insomnia. So you start, the more you take the medicine, the more you think you need to take it. Okay? But I've changed it a little bit because I don't want you to get into the mindset, and I was in the mindset, that I'm talking about a side effect, the primary side effect. But it's really beyond that. It's the primary long-term effect of any medicine is to create those same symptoms. Isn't that amazing? This law is true for homeopathy and natural medicine and pharmaceuticals. So it's not just a pharmaceutical thing. So let's look at the primary long-term effects of Prozac. Now, I just picked Prozac because almost everybody's heard of it, but just you could include this in any of the antidepressants. This is the leading antidepressant, at least it was for many, many years. Prozac's long-term effects, I probably should have put up here, but this is actually from www.drugs.com. I got this list. Matter of fact, I just was picking the ones that already matched our other list. Remember the one back here? Insomnia, and all these things, appetite problems. Because look here, side effects, insomnia, appetite changes. We've already seen this before, haven't we? This is the definition of depression. Diminished ability to think, concentration and mood changes, worsening or severe depression, and suicidal impulses. Okay, now am I being mean to pharmaceutical medicine? Am I just being like, it's all one way or another way? No, because watch this. Before we get to the next slide of the watch this, I want to introduce kind of like how we identify what a homeopathic remedy actually does. Now there's books, big fat books that doctors use. They're about 2.5 to 3 inches thick. They list about 1,200, sometimes more, different homeopathic remedies. Now these are remedies that contain no actual molecules of the original substance anymore. It's just the energetic imprint of a substance based on that substance molecular structure, how it fits together. So to figure out what a homeopathic remedy does, they'll give repeated doses of that remedy. Now it's just energy. And they have a research person who has no symptoms at all. They can't be working. They can't have any spices on their food they eat. Everything is very bland. They can't be stressed out. They can't already have emotional problems or physical problems, because what they're wanting to do is they're going to give repeated doses of that homeopathic remedy to that person until the person starts manifesting symptoms. Isn't that wild? And from that, they say what that remedy will cause in a healthy person, it will also correct in a sick person. That's how you figured it out. Now, it's not too far-fetched from even looking at the Prozac thing, right? Everything that it actually will cause, it will temporarily correct, right? But because it's really a very crude, substance-based remedy that says the difference maybe from allopathic drugs from homeopathy is allopathic medicine says if a little's good, a lot more is better. And even better if we can isolate the one active ingredient, and then you're taking 99.5% pure that ingredient when you take that pill. So it's like you've stripped away all any natural buffers from wherever they found this molecule, and not real curative most of the time. Okay, homeopathy, it actually does seem to actually affect a correction, which if you've heard my last couple of seminars where I talk about the difference between cure versus remission, you're only in remission if all you're doing is suppressing the symptom. That's remember the knife stuck in your leg, and you're taking morphine, and that period of time that the morphine blocks the pain is remission. But because the knife is still stuck in your leg, as soon as the morphine wears off, you still have your problem. Okay, so that period of time where you don't have it is remission. Cure isn't the dirty word, remember that we thought it was, as I went over in a previous lunch lecture. Cure literally is just a restoration to health. If you're actually correcting and taking that knife out of the leg, and you've stitched up the muscle, and you've lasered it, and you've put essential oils on it, and you've done homeopathic remedies to free up that area, and there's actually no knife in your leg anymore, you should not have the pain. It's not like, oh, someday that knife pain's going to come back because I still have a knife in it, right? Right? So we keep going back to homeopathy, and you see again repeated doses of the remedy until you start manifesting problems not only in your body, but they'll track it in the mind. They'll track it appetite-wise. I mean, they may actually have a craving with some remedy that you've been getting. You might start craving fats, and you just crave it. Or you might actually start getting anxiety and depression. So let's look at one of the best remedies for depression from homeopathic medicine. It's interesting because it's called aurum metallicum. Aurum is Latin. All the homeopathic remedies are named by their Latin name. So aurum is homeopathic gold. We've known forever that gold affects the heart, which is also said by the sages to be the seat of the emotions, right? So interestingly, guess what? The long-term effects when taken, I shouldn't have said side effects, the long-term effects when taken for research purposes. And again, I just extracted, because I didn't know this either. I was like trying to go through. I knew it conceptually. I didn't know that gold would specifically match so well with even Prozac and the definition of depression. But we have, guess what? Insomnia. We have weakness and fatigue. We have appetite changes. We have concentration and mood swings. We have worsening and severe depression and suicidal thoughts. And this comes from, if you wanted to look it up, abchomeopathy.com. Just a real quick, easy reference. And that site does not list everything that a homeopathic remedy will do, because sometimes that's pages and pages of things that literally through research, you'd have many, many, many people, what's called proving the remedy for research purposes, those healthy individuals. And there's somebody for research purposes that says, and is tracking every little thing that you're noticing, whether you're constipated, whether you're peeing more often, whether you're sleeping, whether you're hyper, whether there's actually a remedy I've since lost. I was reading on Materia Medica one day that says, patient feels like they have someone else's nose. I'm still waiting for somebody to come in to say, is this my nose? Doesn't feel like my nose. Of course, I've lost that remedy, so I'd have to really dig to try to find it, because there's only one remedy in the world that treats that condition. But how they figured it out was like everybody in the study, apparently, eventually got to the point where they weren't sure they really had their nose or not. I don't know whose nose they thought they had, but it wasn't theirs. So this is homeopathy, but this is, again, going back on the slides, the law of pharmacology. Every drug, natural or otherwise, primary long-term effect is to cause the same symptoms as that which it was initially correcting. Even the most perfectly identified and prescribed medicine, if it's truly correcting something, it should be stopped eventually. Okay? Everyone's pain medicine. Now think about this. The longer you take it, the more you think you need it, because the pain, the medicine itself actually starts creating the pain. Your sleep medicine, your anxiety medicine. Okay? Never mind the fact that if you're masking a symptom, if you take the pill away, the reality is still sitting there, that you still have your illness, but not only that, but it's gotten worse underneath that suppressive medicine. It might as well be an illusion, right? Because you take the pill away, and the reality is you're still sick. So this is the law of pharmaceuticals and natural medicines. So let's get a little more into the heart and how it influences depression and other things that will influence depression. The heart, believe it or not, is the generator for the body. It generates over 1,000 times stronger electricity than the whole nervous system put together. But I guarantee you, if you went on the street and you asked Joe Public, what makes the electricity in your body? They'd say it's going to be the nervous system, because we kind of know electrical impulses traveling along the nerves. It's actually your heart. When somebody is running a race and they see everybody else beating them, we say they do what? They lose heart, right? They're kind of clinically, by that definition we saw earlier, depressed. When you change your heart, you actually change the reality of your mind as well. Research shows now that even before you know that you're going to say something, let's say like the word Michelangelo, just picked one randomly, 5 to 10 seconds before you knew you were going to say Michelangelo, the heart sent blood to the part of the brain that would typically hold that information. Think about that. To get your brain to work correctly, you have to control, and you have to have a good, healthy heart. Kind of interesting that Aurum, that homeopathic gold, affects the heart very profoundly, and thereby corrects what's gone wrong there, and depression becomes less of an issue. So the heart produces light. It produces the most light because it's continually transmitting information to the trillions of DNA in the body through laser-like emissions of light information, and that light is controlling what your genetic makeup does. Imagine that. It's like a hologram that's controlling your physicality, but also your mind. Interesting that the texts, the ancient texts say, guard your heart with all diligence, because out of it comes all issues of life and death. The heart, it was like a very big issue in other times, and now we just look at it like it's a pump, which it isn't, by the way, but that's another seminar. Okay, let's keep going. So again, the heart controlling the DNA to shift dynamically to the changes in our internal and external environment. Now, what do I mean by shifting dynamically to changes in your internal and external environment? If I'm sitting there and I go, "You're terrible!" That's an external event, right? And your heart has to adapt to that instantly and correctly. If you don't react to that, emotionally or any other way, then the heart just keeps on ticking along, and the body actually keeps ticking along, and your mind doesn't be affected by that, right? The ability to adapt to external things might also be going from a dark room to bright sunshine outside. Inability to adapt to that, from a hot to a cold room, from anything like that's dealing with that. So internal environment, again, being like whether you're fed, whether you ate something right or when you didn't eat something correctly, whether you breathed in a toxin and your body's trying to adapt to that correctly, that has to be managed via the light of the heart. Okay? But it will affect, anything that affects the body is going to affect the mind. Okay? No pill, going on here, no pill can rewrite your heart truth. So you will always manifest that which we hold to be true in your heart of hearts. It doesn't matter so much what your mouth says. It doesn't matter that you're joyful on the outside, but you're crying on the inside. The inside's going to win. And there's no pill that can rewrite the fact that you think you're justifiably depressed. Because we see this many times. People go, well, you'd be depressed too if your dog had died. Or you'd be depressed too if you'd lost your job and you'd lost all this. Okay, there's a justification many times. Laser-like emissions of light information. Okay, we'll manifest that now. And the trillions of cells in your body change the chemistry that they're producing to support that emotion. So when a psychiatrist or somebody says, wow, you're really deficient in happy hormones, well, he's just describing the obvious, because your cells are programmed that if a lion walks in this room, every one of our cells changes what it's supposed to do so that we can run away or fight that lion. And every cell changes everything it's supposed to do to support depression, especially when you're sitting there going, you'd be depressed too. My life didn't turn out the way I wanted it. I've heard that so many times. And until you can actually resolve that and kind of go, okay, well, up to this point, we're just going to say everything in the past, which is a very wise thing to do, is to leave it in the past. Who do I want to be now? And I can change the now. It's the only time I can change and I can move forward. Okay? You can't carry around the past and get to something joyful in the future. So a lot of the time when we're looking to homeopathy, when we're looking to natural medicines like herbs, when we're looking for sunshine, so these things that we're going to talk about later, to fix your depression, I want to go on record as going, you have to change what's in your heart of hearts about yourself. You cannot expect the pill to rewrite those truths and somehow make it to where now you're not justifiably bummed out, right? And many times there is a point where somebody actually gave themselves permission, and women are stereotyped this way many times on TV, to where it's like they break up with their boyfriend and they're legitimately bummed out, and so they get the Haagen-Dazs ice cream and some tissues and some sad movies, and they're just going to have a cry fest, right? Well, that'd be really okay if you just left it there. But if you keep going day after day and you're still in your cry fest, You see, there is a moment where you allowed this depressive cycle to get started because you felt justified in your actions and in your mindset. And that's what we're talking about, is many times you have to go back in time and try to figure out, when did I really allow this? Because you allow your chemistry all the time to change. You have like 150 trillion pharmaceutical companies in your body. Not pharmaceutical companies, let's say pharmacies. And they're filling every prescription that you're sending them via the heart patient. So when the Bible, let's say, talks about don't let the sun set on your wrath and negative emotions, I don't know any wrath anymore, but that's basically negative emotions, right? Resolve conflicts quickly. If the guy wants your coat, give him your shirt too. You know, go to anybody you have a problem with and fix it as soon as you can. There's a timing mechanism there. If you go beyond that, guess what? You risk getting stuck in this chemical loop. So it's the chemical loop aspects of it that you can many times address using natural medicines. But at the end of the day, they're never going to be enough. I want you to hear this. It's never going to be enough until you rewrite your heart truths. And it doesn't matter what you say you are, because if that person who's really in their heart of hearts bummed out and depressed because life didn't turn out the way they wanted it to in one respect or another, if you put that person on a lie detector test, and even if that person's all bright and shiny, and they go, I'm really a joyful person. I'm the nicest, happiest person you ever see. I mean, don't you hear me laughing all the time? Oh, I'm notorious for how much. Well, guess what? The lie detector will always squiggle, make that big thing saying lie when the heart does not agree. That's why they can say, I didn't steal the money. Well, the heart cannot lie. The mouth can say anything, but your heart can't lie. And it's that incoherence between the head and the heart that the lie detector test is monitoring. So you see how important the heart is? Even the government listens to the heart to figure out whether we're in alignment with what you're saying. So that's where you need to meditate on that, figure it out, get it to go from head knowledge of I am a joyful person to being truly joyful in your heart of hearts. Then the pills, then the treatments, then the other things that we're going to be doing to help you can really start kicking in. So DNA is not the control center that we once thought. It's more the unique prism the heart light through in order to maintain who you are, deciding to be within each moment. Okay. This is a slide showing the energy fields of the body. Now this would be a perfect adapting individual. All the energetic fields, and these are not some touchy-feely esoteric thing. These can be measured using sensitive medical equipment and other types of scientific equipment. So you're literally not just your physical body. You're transmitting and emitting energy. And many times, if you look at these energetic fields around the body, you might see that this is like your fourth dimensional body. And if you create a problem out here in the fourth dimension and your body is the three dimension, it will necessarily cause a problem in the body itself. Can you see that? Of course, if you stick a knife in your thigh, in your leg, you see that in the three-dimensional body, you're going to create a warpage in the fourth-dimensional energy fields as well. Does that make sense? It really will influence this. So treating at cause is always the goal of everyone at this clinic. Treat at the cause level. If the cause is in the energetic fields, then we're going to do treatment specifically tailored to that. If the cause is in the body, which there's, believe it or not, there's causes back and forth. The body has now just gotten so screwed up because of something in the energetic field that it's too late to just treat it in the field level. You also have to treat it at the body level, and vice versa. If it's in the body, you can't just treat it at the body level anymore because the warpages in the energetic field are supporting it now, and you've got to treat those back and forth. And then when you put this one this way, this comes out that way. So it's a really, really dynamic process of trying to treat somebody in the totality of what's gone wrong in them. So, realities of the universe, especially regarding depression. You cannot point your car north and somehow end up going south. What this means is like you can't practice the actions of a depressed person and somehow get to a joyful, happy person. Now, it sounds kind of cruel and unusual punishment to actually look at a person and say, I know you're depressed, but you can't act depressed. And they're like going, well, I wouldn't act depressed if I wasn't depressed. Right? I mean, there's that justification. I'm depressed, so I'm going to act like I'm depressed. But when a person comes to the doctor, they're saying, I'm going north and I want to go south. I'm depressed, but I want to be happy. So one great friend says, you got to make it. Obviously, she didn't actually make that. Act yourself. You need to like buy funny videos and DVDs and laugh. And when you laugh, even if you don't mean it, you're activating neurotransmitters. Your body does remember what it was producing when it was smiling the last time. So literally smiling releases neurotransmitters that are associated with happiness and joy. I used to be on these big, long trips with kids in the back of the car, 16-hour road trip to go to mom and dad's house, and the kids are going bonkers, and I'm like smiling. But I would smile for miles and miles trying to get the neurotransmitters to kick in, so I wasn't buying into the kids' reality. In the end, what worked best, by the way, is the essential oil, Peace and Calming, and you just put a little drop on the air conditioner vents, and the whole car calms down. It's so cool. So, getting back to the realities, if everything you've done up to this point has created this reality, then if you want a new reality, then you must change everything you're doing. I mean, that sounds almost self-evident, but I learned this more specifically when I trained in Germany with the medical doctors in anthroposophical hospitals. These are hospitals every bit as big as the ones we have here in the United States, but everyone that walks in the door is treated in this totality of natural medicine. It's not like they're doing drugs and then we're going to throw in some natural stuff so that you feel like you're getting integrative medicine. It's like a mixing of philosophies. We're going to give you symptom-suppressing medicines, but we're going to throw in some massages and some vitamins so that you're integrated, okay? The best of both worlds. Well, it's like saying the best of, well, I don't even want to go there. Let's see, I can't think of a good analogy, but you get the point. They would say literally that if you normally answer the phone with your right hand, putting it to your right ear, then answering the phone with your hand is going to change everything. But nudging you out of what's created this is what they're talking about. If you never do anything really that creative in the way of arts, then they're going to have you in the hospital painting and sculpting, modeling, even if you've never done it. If normally you don't sing, they're going to have you vocalize. There's a music room in the hospital just so that you can practice this whole vocalization. There's somebody in the audience that's listening this morning who would actually be fitting perfectly in Germany because she does curative dance therapy. And in the hospitals, you're dancing. Now, that would knock me out of my normal thing for sure. It would create a whole other reality for me, right? Because I don't dance that much. But people have to understand everything you're doing. Whether you wake up in the morning and turn on the news, if you would change that action in any way, you're going to change everything. Okay, so if you're wanting to go north and you're going south, then you cannot keep driving north, right? You can't keep doing those things. You have to change what's going on in the heart level and the whole body level. You cannot practice the actions of a depressed person. You can't be all mopey and somehow get to joyfulness. Okay? Sometimes I want to go on record here is sometimes people will take this kind of like extracting one thing out of a text and taking it out of context. I'm not saying that all you have to do is be happy and fake it till you make it. I'm saying it's part of the process. It's part of it. While you're waiting for the doctor to be able to figure out what else is going on, that's creating this now and how to get you out of this condition. This is what you do the 23 hours of the day that you're not in the doctor's office. Okay? So let's keep going. I wanted to list some natural solutions. This is on the natural side of things. Exercise. It's one of the #1 ways to get out of depression. Now this is about the most going north, and you need to go south kind of actions, because somebody that's depressed doesn't have the motivation to do anything, right? But if you will exercise, and generally not, I don't recommend if somebody's depressed that they try to exercise to some DVD at home. You feel too close to everything that supports that depression. I really recommend that you join a class. I don't care what it is. I've just listed some up here just because they're all good in their way. Pilates, yoga, Tai Chi, aqua aerobics, but outside of the house and getting around people. Okay? So if you really want to get liberated from depression, you're going to have to get out of your house. You're going to have to get out of your box, if you will, that has created this. Omega-3 fatty acids is the next thing on the list. This is actually fish oils. According to research, something like $3 billion worth of research into depression to come up with the Prozacs and everything else, and omega-3 fish oils beats it all. You want to know what else beats antidepressants? 6 times better, according to the research, than antidepressants is sugar. You don't need billions of dollars of research to take something that's 6 times more effective than Prozac. Isn't that amazing? Sunshine, tanning beds in the wintertime will affect this. Okay, if you're just, again, do you see that you got to get out of the house? Because if you're in the house, you're not getting sunshine. Okay, get out, walk, leave the condition behind you're dealing with that's creating this. Emotional freedom technique. Dr. Jowdy does a fabulous seminar, and I think we already have it on the webinar on the website, which is www.hansacenter.blog. That's H-A-N-S-A, Center, C-E-N-T-E-R, blog, spot.com. So blogspot.com. So hansacenter.blogspot.com. Okay? So emotional freedom technique is something that you can learn on your own. It's good if you actually have somebody that can guide you through it the first few times, but you can go on that website, on our website, and you can watch Dr. Jowdy's seminar on how to do it. Increasing temperature. If you're depressed, every cell gets hypofunctional. Okay, if you're low energy, by definition, your mind is going to be more depressed. If you're high energy and you have high temperature, very hard to be depressed. They don't go together. Okay, depression, and that's why you never see somebody that's depressed going, "I'm so depressed. Let's go to the mall because I'm so depressed. Let's go to a movie. Let's go do something." Right? That's totally the opposite spectrum, the opposite polarity. So everything that you can do to get core temperature up, which is also to balance all the chemistry of your body, to address all that we normally talk about, but also investing in something like an infrared sauna. Our favorite is the one from High-Tech Health, same saunas that are used in the Paracelsus Clinic in Switzerland. They could have had any old sauna they wanted, but they went for one built in the United States out of poplar because it does not outgas anything, so most chemically sensitive people could use those with no problems. And a newcomer to our clinic is the Amethyst Biomat. This is a very good infrared emitting, negative polarity emitting mat that you lay on. And again, it increases the detoxification of the body, but you get all the benefits also of warming the core temperature. I'm really wanting one of these before winter comes in Kansas again, because you can put these in your bed where you could not put we now know that electric blankets are horrible for you. They're just emitting too much electromagnetic pollution. And before I get too far from that, depression and laptops. A lot of times people are depressed. They're laying in bed using their laptop, and that laptop is torching the body's electromagnetic energy. So you don't want to do that unless you actually have a protected device on it, a chip that's made by Geo Wellness. It just changed from BioPro to Geo Wellness. Yes, ma'am. Yes, the Rich Way. The Rich Way Amethyst Biomats are the ones that we're using right now. Love them. They are fabulous. And they're not emitting electromagnetic pollution that's harmful to the body, which is really good. So essential oils. If you get the physician's desk reference of essential oils from Scientific Press, I believe it is, there's just an entire section in that book about and what oils you can use and how to diffuse them and how to utilize everything from the common cold to cancer to depression. This is one of the powerful things that you can do at home is essential oils. My preference is therapeutic grade essential oils from Young Living Essential Oils, but there are many good ones on the market. I use some from Germany. I use some all over the world, but my favorites are the Young oils as well. Homeopathic remedies is another possibility. Remember, like the homeopathic aurum metallicum, which was homeopathic gold, but also tautopathy, because many times after you've been taking Prozac for a very long time, just going off Prozac doesn't eliminate the effects it had on your body. And the depression is actually promoted by the side effect, if you will, of having taken it. So tautopathy is a division of homeopathy that many doctors even aren't aware of, but it's where you've homeopathically potentized the pharmaceutical medicine to antidote the adverse effects of having taken that drug. It has no actual drug in that homeopathic remedy. It's just the energy of. And it can get you a long way of getting you weaned off, if you will, energetically even, from the effects of having taken these antidepressants. So another thing that you need to think about is glandular and hormonal and nutritional support for the body. Again, by the time you've been in this loop long, you're going to be getting out in the physical body too. But I want to go on record that the thought comes always before the hormones. Even in sexual arousement, if you want to get sexually aroused, you have to think the thought, ooh la la, look at that lady, how cute she is, or ooh la la, look at that man, look how cute he is, for you ladies. You have to think the thought to stimulate the secretion, and you have to have the associated emotion to have the secretion of the hormones related to that arousal. In the same way, if you want different neurotransmitters and you want different hormones to be secreted, you have to actually get in a joyful emotion, right? So getting glandular help to break that loop is so important as well. Optimizing the coherence of the body, mind, and spirit is the next one on the list with American Biological Medicine. We also go down next with the restoring the light information, again with the heart. Is imprinting the DNA. What happens if the light gets deviated because of scar tissue and adhesions and fibrin just lodged in the tissues and old scars on the body? Well, it can't get the information to where it needs to go. So by getting the light information to where it needs to go is a big part of it. This is involved with vitamin D, which, by the way, you're not supposed to take from the outside in. It is a pro-hormone. It's something your body is supposed to manufacture. And it's not just about sunlight. Sunlight deals with one step in the production of vitamin D. The rest is dealt with the biophotonic light. That's how you make vitamin D. You have to have that light information to the body first, then the sunlight. Sunlight by itself won't work, which is on the beach and tan all the time, and yet their vitamin D levels are low. So just because you can get a good effect doesn't mean it's the right way to do it. Optimize the location of your assemblage point. The assemblage point is where the axis, the rotational axis of some of the electromagnetic fields rotate, and if they're too low, you're going to have depression. Then we can use magnetic negative polarity therapy. Everyone that's here in the room has experienced that, or at least observed us using magnets on patients. Again, like every tool, it's best in the hands of somebody that knows what they're doing. So I'm not saying to go out there and just put magnets on your head, because without the right knowledge of what to do, you can definitely mess yourself up. So dietary changes. Again, the difference between warming foods and cooling foods. A warming food is going to be what? What do you imagine? Is it going to increase depression? It's going to increase temperature, right? If it's warming the body, so it's going to decrease depression. Isn't that neat? Now, let's take something about this, because cooling foods are going to do what to depression? They're going to make it worse, big time. Okay, so a lot of the time people are reading things all the time on the internet, and they're getting inundated with all these companies trying to sell them nutritional supplements like green tea extracts and stuff. And while that research is good for the right person, green tea is a cooling herb. What's it going to do to somebody with depression? It's going to aggravate it. Okay, if somebody has weakness already, and overcooling of the body, and they dominate their diet with things that are actually cooling, they're going to get aggravated by it. If they have constipation already, which is a overcooling of the body and a problem of cooling, then cooling foods like green tea is going to make them even more constipated. Okay, so you can see kind of how that even plays a big role. And if you want a list of warming and cooling foods, they're in my Lyme disease book called Beating Lyme Disease. Okay, it's the 2nd edition book. Or you can contact the clinic, and we can email that to you. So if you want to contact the clinic, you can call at 316-686-5900 for those of you on the internet. You can actually email info@hansacenter.com. That's info, I-N-F-O, @hansacenter.com. So let's keep moving along here. This is just I found while I was researching some of this. And this is the omega-3 connection and some of the research that was done by a Harvard psychiatrist. And just all the evidence about how the fish oils so overwhelm the things like Prozac and their effectiveness. This is such a simple thing that we can do, is just take fish oil, which you can get almost anywhere. You need to really find a good brand, okay? But because Walmart is not your go-to place, by the way, for good nutrition. It's your go-to place for cheap nutrition. And it's a lot of times synthetic vitamins, and you have no idea what kind of fish they're using for fish oil. So be careful, buyer beware on that kind of thing. So, but the omega connection, for those of you that really want to get the data, and that helps, because when you read and you can buy into a process, your believing goes up, doesn't it? And depression is also kind of improved just with that kind of knowledge. So how do we heal anything? Because it really comes down to how we're going to fix it. Not only what we call it, we're going to call it depression. True healing is not occurred by simply masking the symptoms. This is a statement I came up with 15 years ago when I was trying to separate ourselves in what we do from what is being done. You cannot heal anything by suppressing the symptom. You can't mask the symptom. You're not having depression from a deficiency of Prozac or any of the other things. You're having depression from a deficiency of essential fatty acids that are needed by your body to make hormones and other things. Does that make sense? Why fish oil might help. Okay? But even in my mind, that's just a benefit. It's probably not going to also get deep enough by itself. So if somebody says, well, I'll integrate fish oil, but I'm not going to change my thinking, and I'm not going to exercise, and I'm really not going to get out and do anything because I'm too depressed. He really doesn't understand. Dr. Jernigan does understand how depressed I really am. Well, everything you're doing is creating everything that is. So want something new? Do everything different, not just one or two things. Do as much of this as you can. So true healing is the product of guiding and facilitating the restoration of the integrity of every aspect of the body, mind, and spirit through thoughtfully applied physical treatments, natural medicines, and therapies, as well as through teaching and coaching one back to optimum health on all levels. That's a whole mouthful. But that's what real, true healing involves. This isn't some guy in a white lab jacket sitting across a desk from you and barely ever looking up from the lab test that he just is looking at. This is not about the numbers on a piece of paper from your blood test, which is, by the way, just a snapshot of who you were when your blood was drawn. It could be different later on. So you want healing? This is what it's going to take. All these different issues. Optimum health is that point where the body, mind, and spirit can adapt instantly and correctly to any change in its internal and external environment. That is where optimum health is. Optimum cure is what I'm talking about. That four-letter word that we didn't ever want to talk about, but now we know we can, because all it means is we've had a restoration of health, not a masking of symptoms. Well, I hope this makes sense to you, and I hope you enjoyed it. Are there any questions? Anybody? Yes? Absolutely. Very good question. The question is, can you overdo warming foods and cooling foods? Absolutely. If you predictably, you would know that peppers are on the warming foods list. Okay, like cayenne pepper and jalapeno peppers, habaneros. So if somebody wanted to just say, hey, I'm depressed, so I know I need warming things, I'm just going to do a ton. I'm just going to dominate everything warming. Well, then the body actually gets overwarmed, and then its effect is to try to do what to you? Cool you down. So this is why even in, this isn't really a question, but it's the same point that Asian doctors have been saying for probably 1,000 years. They say, if you're going to take a hot bath or a hot shower, if you can feel it, it's over 100 degrees, right? Because your body is almost 100 degrees. So a lot of the time during the wintertime, I had a friend that was like, would come out just red like a lobster because it was so hot. The water was so hot. And the body tends to take you too low at the end. And especially when you're really trying to find health, the body has a hard time regulating its temperature correctly. So the best of all is to take a shower. If you're going to take it hotter, then you need to finish with the very end. And then your body has an easier time normally. If you can take an extremely cold shower, then finishing off with a little burst of warm. If you're going to eat something that's very hot, like peppers, that you would actually balance that with some cooling foods as well. So yes, don't take this to the extreme. Very good question. Exactly. Yes. And it isn't that those foods are bad. Don't get out into that like these are bad, these are good. Because you see, they're all based on where you are at that moment. But Asians, they don't eat based on what they're hungry for. They eat a lot of the time based on what their mind is doing and what their body is feeling like and stuff. They put in their body as to something that happens maybe over the next 3 days. I mean, imagine that you ate something one day and 3 days later you're still having the effects of it. So if you really got good at it, you really would eat based on what your consciousness body feels like appropriately. So any other questions? Well, thank you for coming. I hope you learned a lot. So y'all have a great day.